Good afternoon and welcome everyone. It's wonderful to see so many people joining us today. I'm very conscious we've got lots of people just coming into the lobby, so I'll make a start and I'll just share a little bit about the session today and what to expect, and we will get started. So yeah, good afternoon, welcome. Thank you for taking time out to join us today. In this 1 hour session, we're going to be looking at sexual health and wellbeing of young people in Scotland. So we'll share some of the current evidence. We're going to hear insights gathered directly from young people, so we'll be covering that as well. And we want to invite you to shape the priorities that are going to be taken forward to a summit that's due to be held next month. So that's the plan, but we're going to share some evidence, insights, hear from young people and get your thoughts to take forward the discussion from today's session. So it's hopefully the start of a wider discussion. We'll share a little bit more about that as we go. Just in terms of what we will be covering today, in this session you'll hear from a range of speakers covering different aspects of young people's sexual health and wellbeing. We recognise that sexual health and wellbeing is a really integral part of young people's lives, and for the most part it can be a really positive thing. In today's session, we do look at some of the challenges that young people face, but we just think it's important to acknowledge that context up front. So we will share that. And just to share, the session today has been hosted by a steering group. So this consists of stakeholders from the Scottish Government, health, academia, and young people's organisations. And today we're going to hear from a selection of those organisations. So these are the topics that we're going to cover today. What I would acknowledge is that some of the content discussed covers sensitive issues. So in digital context, we'll touch on issues such as child sexual assault and sexual assault and experiences in relationship. We touch on topics such as non-fatal strangulation. So what I would say is please take care of yourself. You're welcome to step away or step out of the session at any point, rejoin, whatever is needed. I would say that we are recording the session today, so if you want to come back and revisit or watch anything in your own time, it will be shared with all attendees and all people who registered for the session. Also, just bear in mind some of the content might not be suitable for children, so please do keep them in mind if you're joining from home and they're in the background. So that's what we'll be looking at. We'll start with the background and insights from young people. We'll also look at the digital context for young people and children in Scotland, and then touch on young people's sexual experiences, relationships, hear the latest insights research on that. And then we're going to look at engagement with contraception and sexual health outcomes. And finally, we'll bring it together with the cultural context of sexual health and relationships. We will be coming back to get your insights at the end. So as you go, take notes. What are we missing? What things are important to you? What are you seeing in your role or in your practice? And I am going to hand over to Nikki from Greater Glasgow and Clyde NHS. And Nikki is going to tell us some of the experiences and insights that we got from engagement with young people.
Okay, thank you, Joanne. I'm Nicky Collier. I'm Health Improvement Manager for Sexual Health with NHS Greater Glasgow and Clyde. And as Joanne said, we have this summit coming up next month. And in preparation for the summit over the last year, the steering group's been running a series of focus groups with young people from different parts of Scotland to get their thoughts on what they want the summit to focus on, and also really what actions they would want to see taken forward in relation to their sexual well-being. So across those focus groups, we asked young people what matters to them in relation to sexual health and well-being, to reflect on what support they've received on these issues that they're raising, and just to give us also their recommendations for what they would like to see happen. And perhaps unsurprisingly, across all groups of young people, school-based education was what they mostly consistently discussed. Good to acknowledge that while some young people had positive things to say about their education, which was good to hear, they also had a lot to say about how things could be improved. We heard that some young people had received very little or no RSHP, And we heard that where young people had received RSHP, the consensus from them was that it was insufficient and that it didn't cover the things that were really important to them in a depth that was sufficient for their needs. Interestingly, most young people received no RSHP at all after S3, a really key stage. Relationships is something that young people really want to learn a lot about, and their experience of what they learned at school was mostly focused on what happens or what to do in the worst case scenarios, and very little about how to make relationships work well or make them good. And we heard from young people that attend denominational schools that they had received almost no RSHP that was of any relevance to them at all. So in thinking about young people's relationships, they expressed a desire to be better equipped to manage consent in relationships, and they would welcome a much greater focus on pleasure in intimate relationships. Young people also said they have concerns about their safety in relationships, both their online relationships and their offline relationships. They also noted that they would like reliable information and support about how to protect themselves from the unintended outcomes of relationships. Now, periods wasn't something the steering group we'd considered particularly as a sexual health issue, but all the groups of young people unprompted raised this as an issue that they consider fits under the broader heading of sexual well-being, and it matters a great deal to them. Well, I think the key issue they raised is that as a whole, they still feel they have insufficient knowledge about all aspects of menstruation. They also told us they could give us plenty of examples of free period product provision and how that they were perceiving that as inadequate. And girls particularly were telling us that they still need safer single-sex spaces in which they can ask questions about menstruation where the boys are not present. Overall, young people were telling us that sexual health and well-being is still very much a taboo subject. It very much acts as a barrier to having open and honest conversations about sex, and it acts as a barrier to engaging with education or engaging with services. Young people were telling us they'd like to see a culture where talking about sex has become normalized, and they referred into the way that over the last 2 years, mental health has gone from being a very taboo subject to something that's more, they feel more able to talk about, and they would like to see a similar change in relation to talking about sex and relationships. They also acknowledged that worries about or actual issues that they've experienced in relation to confidentiality still remain a significant barrier, and that's particularly the case for young people in more rural communities. Across all the groups, most young people didn't know about local sexual health services, didn't know where they were or how to access them, which was disappointing to hear. Young people do, however, have confidence in the NHS, and they have confidence in their GP, both in terms of service provision and in terms of information. Where young people lived in areas where there was no nearby sexual health service, they flagged this as a frustration. And again, this was especially the case in terms of rural and island communities. And where young people lived in areas where there were sexual health services, they flagged frustrations with the waiting times that they had for some of those services. I think this quote here in terms of young people's life online, this really sums up wider views that young people have about us as adults and our knowledge about young people's online lives. Young people are concerned about their online experiences, and especially AI. So they're concerned about AI from a number of perspectives. They told us about and they shared experiences actually of issues with the creation and sharing of deepfake intimate images, but also in relation to AI, they're using AI as a source of information, sometimes for sexual health information, and yet they are aware that this is not a reliable source of information. Overall, they really value being online, and we're having, of course, this debate about what's acceptable social media age for young people, but they value their online lives, but they do want it to be safer and they want more education on the safety aspects. And then just a few worth saying as well, and for young people who lived in areas of Scotland where there is the facility to have a live online chat with a health service staff member, that's a highly valued model of access to health and support. So that's a summary, a very quick summary of what young people have been telling us over the last few months as we prepare for the summit. I'm now going to hand over to Niamh, who's going to take us through the next section.
Hello everyone, I'm Niamh Musson, Policy and Public Affairs Officer at NSPC Scotland. I'm going to lay out the digital context for children and young people in Scotland. Mobile technology is an integral part of the lives of children and young people in Scotland. Data shows us that 62% of 8 to 11-year-olds in Scotland have their own mobile phone, and that this rises to 96% for 12 to 15-year-olds. Most young people now see the online world as an extension of their in-person lives rather than as something entirely separate. It's a core part of how they form and maintain relationships, express themselves and access information. However, just as there are opportunities online for children and young people, there are also risks and harms. I'm going to explore some of these now. Technology-assisted child sexual abuse is defined as child sexual abuse with any online element that occurred prior to an individual turning 18. Technology-assisted CSA is often used as an umbrella term for online grooming, abuse through the production or dissemination of sexual images and self-generated sexual imagery occurring before the age of 18. The reason we use the term child sexual abuse material instead of child pornography is in recognition that child sexual abuse material is the result of children being groomed, coerced and exploited by their abusers, and is a form of child sexual abuse. We think that by using the term child pornography, there's an implication that's a subcategory of legally acceptable pornography rather than a form of child abuse and a crime. In short, using the term child pornography minimises the harm experienced by children, which research shows us can be both long-lasting and devastating. In 2024, the Internet Watch Foundation received a record-breaking 291,273 reports of child sexual abuse imagery. 97% of the reports showed the sexual abuse of girls. Compared to other forms of online sexual abuse, there's a significant proportion of prepubescent children with greater severity of abuse for younger ages. The mean age of a child in child sexual abuse material recorded by the IWF was 10. And almost a third of the images and videos that the IWF categorised in 2024 included Category A child abuse, the most extreme category, which includes rape, sadism, or even bestiality. Grooming is the process that involves the offender building a relationship with a child and sometimes with their wider family, gaining their trust and a position of power over the child in preparation for abuse. Grooming can happen anywhere, including within organisations, in public spaces and online. Ofcom found an 89% increase in online grooming crimes against children between 2017-18 and 2024. The data reveals that the most common platforms that perpetrators use to target children online were Snapchat, WhatsApp, Facebook, Messenger, and Instagram, the last three all owned by Meta. Advances in online technology, from social media and messaging apps to online gaming and live streaming, have transformed the way that children and young people interact with others. While this digital landscape can add great value to a child's identity and life experience, it's not without risks. One such risk is sexual extortion, commonly referred to as sextortion. This is a form of online blackmail that involves the threat of sharing intimate or explicit images or videos to extort money or to force someone to do something against their will. In 2023-24, Childline delivered 903 counselling sessions to children and young people relating to blackmail or threats to expose or share sexual images online. More than 2/3 of Childline counselling sessions about blackmail or threats to share sexual images last year were with boys, compared to 31% for girls. There were thematic differences in the types of experiences shared by boys and girls with Childline. Counselling sessions with boys tended to revolve around financial blackmail, whereas girls typically spoke about being pressured to send more nude or semi-nude images rather than money. Some children affected by sextortion told Childline they were being blackmailed by someone known to them in person, such as someone they described as an ex-boyfriend or ex-girlfriend. Other children spoke about being targeted by someone they didn't know on social media and other online platforms, someone who at first appeared to be another child or young person. The National Crime Agency issued an alert to all UK schools in early 2024, following a more than 50% increase in incidents of sexual extortion globally. Very sadly, there have been a number of suicides reported as a result of sexual extortion. A recent well-reported incident being 16-year-old Murray Dowie in Dunblane in 2023. A recent NSPCC report published in 2025 highlighted that generative AI technology poses a variety of risks to children. While the public discourse has often focused on the threat of AI-generated child sexual abuse material, the research identified evidence of a total of 7 safety risks associated with generative AI, including sexual grooming, harassment, bullying, sexual extortion, harmful content, harmful ads and recommendations, and child sexual abuse material. The IWF received 245 reports of AI-generated child sexual abuse material in 2024, compared to 51 in 2023. This is a 380% rise. Of these, 193 involved imagery that was so realistic it had to be treated in exactly the same way as real photographic imagery of child sexual abuse. An issue many of you will have seen in the media in recent weeks is that there's been public attention to concerns about AI and specifically nudify apps and functions. A Children's Commissioner for England 2025 report found that women and girls are almost exclusively the subjects of sexually explicit deepfakes. 99% of sexually explicit deepfakes accessible online are of women and girls, and the tools that are used to create them often don't work on images of men and boys. One plausible explanation for this is that these tools are typically trained on large data sets of sexually explicit imagery. AI tools create images by learning from and replicating elements of existing images. This means that these tools are likely to only work on female bodies because they've been trained largely on images of female bodies, as these make up the vast majority of explicit images available online. In the UK, the National Crime Agency has recently identified online communities of teenage boys sharing extreme and sadistic material, including sexual material, as an emerging threat to radicalisation and extremism. The report found that AI was expediting offences and that the offenders were predominantly teenage boys. Recently, Grok, the integrated AI application on X, the site formerly known as Twitter, launched a feature with the ability to create AI-edited images of real people, allowing users to put them in revealing clothing and in suggestive poses. This function exploded on the site and resulted in the generation of explicit images, first of high-profile celebrity women and then of children. After global pressure, the feature is now disabled in jurisdictions where it's illegal, and there's a current Ofcom investigation over whether this Grok feature broke UK laws, and the UK government has committed to strengthening legislation if necessary. However, there are concerns that many of these controls can be circumvented by use of a VPN and that a large amount of harm has already been caused. Intimate image abuse is a term that encapsulates receiving unwanted requests for sexual images, receiving unwanted sexual images, receiving pressure or being coerced to produce or send sexual images, and the non-consensual sharing of sexual images. Evidence reviewing prevalence of young people sharing nude and semi-nude images with their peers ranges from suggesting that around 20% of young people have shared a nude image to around 50%. The sharing of self-generated images between young people is not necessarily a harmful practice. In many cases where image sharing is consensual, mutual, or reciprocal, it may be classified as developmentally typical sexualized behavior. However, there are significant risks and 2 predominant safeguarding challenges. Firstly, while not all imagery is produced for these purposes, all sexual imagery of children can be viewed as child sexual abuse material. If shared with or created at the request of adults, this is child sexual abuse. Secondly, these images can be shared between young people without consent, causing significant harm to the young person in the images and requiring a careful safeguarding response to all children involved. Ofsted identified non-consensual image sharing as one of the most prevalent forms of harmful sexual behaviour occurring within schools in the UK. Research suggests that 24% of girls and 24% of boys who've taken a nude or semi-nude image have had it shared with others without their permission. Overwhelmingly, girls are more likely to receive explicit images without consent, And one Swedish study even found that 9 in 10 girls had received unsolicited nude photographs. Defined as unwanted or non-consensual interaction between peers, online sexual harassment is intended to make the victim feel upset, threatened and coerced, humiliated, sexualized or discriminated against. It occurs largely within existing peer networks and involves an active, engaged online audience. Although the UK has produced no new evidence since 2017, prevalence figures from elsewhere suggest that 8 to 20% of children experiencing online sexual harassment that is not specifically related to sexual images. The most common response to online sexual harassment and to intimate image abuse by young people is to delete messages and images or use technical tools to block unwanted contact. Reporting to platforms and offline help seeking is less common, owing partly to concerns about the reactions and judgments that would result from telling adults like parents and carers or teachers. A common response from young people is to do nothing. This appears to be linked to feelings of self-blame, concerns over judgments, or the perception that victimization is a normal and inevitable consequence of being online, and that nothing can be done once sexual images are leaked. Sex is kind of broken now. A 2025 report by the Children's Commissioner for England found that pornography is widespread and normalised to the extent that children cannot opt out. The average age at which children see pornography is 13. By age 9, 10% had seen pornography. By age 11, 27%. And by age 13, 50%. 59% of young people surveyed reported seeing pornography online by accident, and this is up from 38% in 2023. Research has found that the boundary between what is and what is not sexual violence is distorted by mainstream online pornography platforms. 40% of young people learned about sex as a teenager through pornography, so this is very important. Children are frequently exposed to violent pornography, with 79% of 18 to 21-year-olds having seen content involving sexual violence before turning 18. A significant portion of young people seek out violent pornography. 36% of young adults had sought out content involving at least one act of sexual violence. A young age of first exposure and frequent consumption of pornography were predictors in the likelihood of actively seeking out violent content for sexual gratification. 47% of respondents to a survey carried out by the Children's Commissioner stated that girls expect sex to involve physical aggression, such as airway restriction or slapping, and a further 42% noted that most girls enjoy acts of sexual aggression. A 2025 UK survey found that 39% of secondary school teachers were aware of at least one incident of misogynistic behaviour from a pupil in the last week. Data from a 2024 Vodafone study found that 7 in 10 boys had encountered posts promoting misogyny. 42% of parents had heard their sons make inappropriate comments because of what they'd seen online, including sexual, violent or degrading comments about women and girls. Some young people may actively search for violent and misogynistic content online, but we know that they often report simply stumbling across it, with this content being promoted to them through a service's algorithm. Studies carried out by researchers and journalists highlight that young boys can be fed a high level of misogynistic content from influencers like Andrew Tate, despite never searching for it. One investigation showed that users would often be recommended Andrew Tate videos on TikTok after viewing non-harmful content generally aimed at men. Another report found that almost 30 videos featuring the Tate brothers were served to a fake account of a teenage boy within a 2-hour period on YouTube Shorts. A research project led by UCL and University of Kent looking at TikTok found that after only 5 days of using the app, there was a 4-fold increase in the level of misogynistic content being presented on the For You page for the simulated young male user profile created by the study, with the user exposed to increasingly misogynistic ideologies. The report highlights that the increased frequency of this content helps to create a digital echo chamber which normalises these views and attitudes amongst boys. I'm going to leave you with this quote from a girl aged 13 who phoned into Childline about the impact this has had on her. You've probably heard about Andrew Tate, the influencer famous for posting sexist and misogynistic content. All the boys in my class talk about his videos. They're so influenced by him. They started picking on me and some of my friends because we are girls, wanted to become things that aren't for women. It's made me feel like I'll never get into my chosen field, considering people like them will be in the future generation. I hate it so much, but I know I can't do anything to stop it. I'm going to leave you with that and pass over to Ruth.
Thanks, Niamh. So, thanks to Niamh, who's outlined the digital environment in which young people are growing up. And so in this section, we're now going to turn to their sexual experiences and relationships. And obviously acknowledging that online and offline experiences are, of course, intertwined, but our focus in this section is really on in-person sexual experiences. And as Joanne noted earlier, we're starting from the understanding that sexual development is a normal and healthy part of adolescence. Romantic and sexual relationships can contribute positively to young people's lives, for example, by fostering social connection and self-esteem. But at the same time, these experiences can involve challenges such as shame, coercion, or violence, and these can have really lasting impacts on health and well-being. So we're going to start by examining evidence on young people's partnered sexual behaviour and how this is changing over time. UK population surveys indicate that the average age of first sexual experience is 14. It's important to note that this definition of sexual experience is broad. Typically, this first experience would not be intercourse. It includes any in-person activity that respondents consider sexual, so that might range from kissing to practices involving genital contact. And amongst older adolescents and young adults, sexual practices have long been diverse. So between the year 2000 and 2010, there were substantial increases in the proportion of young people that were reporting oral sex and experience of anal sex as well. But more recent survey data show other shifts. So compared with previous generations, the average age of first intercourse is rising after decades of decline, and fewer young people are reporting having intercourse before age 16. Internationally, multiple high-income countries are also observing a trend of more young adults in their early and mid-20s reporting never having had any partnered sexual experience. And in Britain, upcoming findings from the 4th National Survey of Sexual Attitudes and Lifestyles will clarify trends in sexual inactivity amongst young people. Another notable shift, of course, concerns the diversity of sexual partnerships. So surveys confirm that more young people are having sexual experiences with same-sex partners than in previous generations. And Scotland's 2022 census found that 1 in 10 people aged 16 to 19 identified as LGBT+, with higher rates amongst young women and a particularly notable rise in young women identifying as bisexual. So in summary then, today's landscape is really characterised by a later average age at first intercourse and more young people reporting no sexual experience at all. But nonetheless, adolescence remains the life stage where most individuals have their first partnered sexual experiences, and sexual practices and identities amongst young people are very diverse. So data on sexual behaviour, they give us a picture of what young people are doing sexually, but they don't necessarily tell us how they feel about their sexual lives. And the concept of sexual well-being helps us understand this better. So sexual well-being refers to a person's thoughts, their feelings about their sexual life, including whether they feel respected, whether they feel safe, supported, comfortable, and whether they have a sense of self-esteem and agency in their sexual lives. So at the University of Glasgow, we recently conducted a survey of sexual well-being amongst the Scottish population aged 18 to 65, and we found that across all age groups, those aged 18 to 24 are the most likely to report low sexual well-being. Oh, excuse me. And we get a sense of what this means when looking at specific aspects of well-being. So our measure of sexual well-being is made up of 13 questions, and to select just a few, more than 1 in 4 young people reported that they do not find their sex life pleasurable. More than 1 in 4 worried about what might happen to them in their future sex life, and more than 1 in 5 did not have someone in their lives that they could talk to openly about sex. A further finding in our survey of sexual well-being was that around 1 in 6 young people disagreed that they only do sexual activities that they really want to do, and that really indicates constraints on sexual agency. So the issue of consent in young people's sexual relationships has received considerable attention in Scotland in recent years, and there's been development of multiple resources for professionals and awareness campaigns aimed at young people from a variety of different sources. But despite growing public discussion about sexual consent, research from the University of Edinburgh shows that young people today still experience significant barriers to enacting consent, such as fearing a partner's disappointment if they refuse an activity that they don't enjoy. And these challenges are particularly concerning in light of emerging trends in sexual practices. So, for example, non-fatal strangulation during sexual activity is increasingly recognised as a practice that's becoming commonplace amongst young people, both in the UK and internationally. So often referred to by young people and the general public as choking, non-fatal strangulation has been defined as application of external pressure to the neck that obstructs blood flow and or breathing without directly causing death. Non-fatal strangulation can be agreed to by both parties or not, but prior agreement doesn't in itself change associated risks. So common short-term effects of strangulation include difficulty speaking or breathing and changes in consciousness, and these are obviously factors that can severely limit the ability to communicate explicit and ongoing consent. There's also growing concerns about links between non-fatal strangulation and increased risk of stroke, and this has prompted calls for public awareness campaigns that help young people to understand risks. As for prevalence of non-fatal strangulation amongst young people, evidence remains limited due to inconsistent data capture across services and also the absence of relevant questions in large-scale population surveys. So currently there's no Scotland-specific prevalence estimate. However, questions on non-fatal strangulation have been added to the 2025-26 Scottish Crime and Justice Survey, and the findings of that are expected no later than 2028. Some of the most robust data that we currently have available on non-fatal strangulation amongst young people in the UK comes from a recent study by the Institute for Addressing Strangulation. And this survey included over 4,000 young people aged 16 to 34, and they were quota sampled so that they were nationally representative with respect to their age, sex and region. Amongst respondents with prior sexual experience, 2/3 reported having been strangled at least once, and 45% reported having strangled someone during sex. Of those with experience being strangled, just over half were female, 47% were male, and 1% preferred not to say. And the most common age at first experience of strangulation was between 18 and 20. Strangulation was most often occurred within relationships, so 77% reported it happening either with a current partner or an ex-partner, and just under 1 in 5 reporting strangulation happening during a one-night stand. On the most recent occasion of having been strangled during sex, 70% said the strangulation had been agreed to in advance, but 26% said it had not been discussed beforehand, and 1% said it had been discussed but they hadn't agreed to it. While reported enjoyment was generally high, 1 in 5 young people did report negative feelings or physical symptoms. So as a result of strangulation, so things like feeling scared, feeling anxious, neck pain and dizziness. So in summary then, within this quota sampled study of young people, non-fatal strangulation during sex was common. A substantial minority of these experiences occurred without prior agreement, and for some young people the costs to their well-being were high. So these findings really need to be understood within the broader context of young people's sexual and intimate relationships in Scotland, where violence is pervasive and often under-recognised. Violence can include sexual violence, physical abuse, emotional and psychological abuse, coercive control, harassment and technology-facilitated abuse, as Niamh has already discussed. Understanding the extent of violence within young people's relationships isn't straightforward because it's shaped by how violence is defined and measured, and it's also obscured by widespread underreporting. In 2023 to 24, Police Scotland recorded over 10,000 incidents of domestic abuse where the victim was aged 25 and under, which is 16% of all recorded domestic abuse in Scotland, and almost 2,000 of those victims were aged 18 or under. But these figures undoubtedly underestimate the true scale, as much abuse is, as we know, never reported to police. So in contrast, surveys often capture a wider range of experiences of violence, including those that haven't been reported to police. But again, findings are shaped by the types of surveys and the questions that are asked. The Scottish Crime and Justice Survey found that just over 1 in 5 people aged 16 to 24 had experienced partner abuse since age 16, and just under 1 in 10 within the last year. The most common forms of psychological abuse were controlling behaviour, being put down and being isolated from friends and relatives. And the most common forms of physical abuse included being pushed or being held down, being bitten, kicked or hit, and having something thrown with harmful intention. In terms of attitudes, the Young People in Scotland survey offers really important insight into how young people interpret violent and harmful behaviours in relationships. So this was a study conducted with 11 to 18-year-olds in 50 Scottish schools, first in 2014 and then again in 2021. And pupils were asked to respond to a range of scenarios of relationship violence involving physical abuse, controlling behaviour, stalking and so on. And overall, across the 7-year period, attitudes shifted significantly. So more pupils came to perceive most of the scenarios of violence as wrong or harmful in 2021 than had done so in 2014. But these changes were driven by a greater shift in attitudes amongst girls rather than boys. And across all scenarios, girls were consistently more likely than boys to view the behaviour as wrong. So this really underlines the need for gender transformative approaches that reinforce anti-gender violence messages in every part of society. And that really underpins Scotland's Equally Safe strategy. And key within this are models of primary prevention which challenge the inevitability and acceptability of gender-based violence and which recognise young people not only as potential victim survivors but also as agents of change. And these principles are reflected in initiatives such as Equally Safe at School, which is a programme that's been developed here in Scotland and adopts a whole school approach to staff and students really working together to promote gender equity and prevent sexual harassment at school. So to summarise then, evidence on young people's sexual relationships and experiences indicates that young people are navigating increasingly diverse sexual practices and identities. Young people are not always experiencing well-being, pleasure or support in their sexual lives. They're facing persistent challenges around consent and safety, and they're often experiencing violence in their intimate relationships despite shifting attitudes. So I'm going to hand over now to Rosie.
Thanks, Ruth. Sorry, I skipped that one. So Ruth's just covered some background on sexual behaviours, and I'm going to go on to speak about contraception and some sexual health outcomes. So in general, the most commonly used methods of contraception are condoms and pills, which include the combined oral contraceptive pill and the progesterone-only pill. Contraception use is declining, and most sexually active people report no method of contraception, which you can see in this pie chart here, which is taken from a BPAS survey, which is British Pregnancy Advisory Service, published at the end of last year. A recent study looking at contraception use in 2018 and those attending abortion clinics in 2023 showed a rise in the proportion of those reporting no method of contraception over this time, which is that central graph there, and you can see the top blue line is no method of contraception. There was a decline in all other methods of contraception, except fertility awareness-based methods, which is a very small line at the bottom, which did increase significantly over the same time frame. So there are multiple drivers to this and too many to go over today. So I'm going to just focus on a few, and later on Nikki's going to pick up on the RSHP aspect of this. So in terms of access, there are multiple barriers in access to contraception, and these have an intersectional nature, with those living in the most deprived areas from certain ethnic minority groups and other marginalised groups facing the greatest barriers in access to contraception. The COVID pandemic disproportionately impacted younger people, and it's important to note that there are certain pinch points as well. So access to long-acting reversible methods of contraception, such as coils, are particularly difficult to access after you've had a delivery, so after you've given birth or after you've had an abortion. There was a recent study that was done, which was a cross-sectional study of young people in Scotland called the Conundrum Study. And it asked young people about condoms and contraception and how easy it was to access these. Young people reported, around about a third of them reported that it was either difficult or very difficult to access contraception from a GP practice, and about the same reported it was difficult to access from a sexual health clinic. However, around about a third also reported it was easy or very easy to access. That same study also highlighted that young people were uncertain about the legitimacy of attending healthcare services for contraception, and that because of this they were self-censoring because they felt that their contraceptive needs were not a priority. The same conundrum study also demonstrated that young people were reporting that when they had conversations about contraception with healthcare providers, they were often feeling not listened to or being dismissed. And indeed, this quote here is taken from that. We've seen in the medical literature that there's been a rise in medical gaslighting over recent years. However, the conundrum study also highlighted that young people really did seek out and want trusted, reliable information on contraception, and they saw the NHS as this kind of trusted provider of that. But they felt that the information that was being given to them from these sources wasn't complete and was actually missing information about particular aspects of contraception that they were wanting. This led to a breakdown in trust and for young people to seek out information from alternative sources. One of those alternative sources is social media. So social media is providing a platform for young people to read about other people's experience of contraception and to share their own experiences. It is a legitimate platform that shouldn't be dismissed. However, it is also a targeted echo chamber where an algorithm is is pushing negative images of hormonal methods of contraception, particularly at younger women, and also elevating other methods such as fertility awareness-based methods, and that this information is also containing some dis and misinformation. It is not always clear where experience is becoming the expert, and also who is pushing these narratives. So most of the accounts are set up for non-nefarious reasons. However, some of them have commercial backing or political agendas, and we're leaving young people to navigate this and to critically appraise this on their own. One of the symptoms that is kind of being played out on social media is that of hormone hesitancy. In 2021, a systematic review by Le Guin pulled together 8 key themes of why women were moving away from hormonal methods of contraception. It found that the avoidance of physical and mental health side effects, there was concerns about impact on libido, fertility, menstruation, and this preference for natural methods. What is becoming increasingly clear is that women are not tolerating the burden of contraception as much as they used to, and with the increased access and reduced stigma of abortion, that the risk calculation and priorities and preferences appear to be changing. In 2024, the World Health Organization published a report which showed an alarming decline in the use of adolescents using condoms, and this was seen globally with an increase in sexually transmitted infections and unintended pregnancies. So looking at Scotland in particular, it's difficult to measure the use of condoms because it's not a prescribed method of contraception, so we can turn here again to survey data and the Conundrum survey. Conundrum showed that young people were using condoms, and indeed 93% reported using a condom at least once. However, when they were asked about their most recent sexual partner and the first time that they had sex with them, only 62% were reporting using a condom. There was multiple reasons for this, but the top 3 were that they were using another method of contraception, they decided not to use a condom, or they got carried away in the moment. The qualitative data around this is also interesting because it highlights that young people also lack confidence and uncertainty as to when to initiate conversations around condoms. So moving to long-acting reversible methods of contraception, so this includes implants, coils, and injectable contraceptives. They are the most cost-effective reversible method of contraception that we have. In the under 20s, you can see this data here that is presented is from prescribing data, which is the blue line, and sexual health data, which is the red line. And you can see over recent years that there has been a decline in their use. The V that you see in the middle is the COVID pandemic, where access to this method of contraception was particularly challenging. And whilst it has recovered, it has not recovered to the same extent that it did pre-pandemic. So other methods of contraception are combined oral contraceptive pill and the progesterone-only pill, which I mentioned earlier. So these data are presented from a study published by the BMJ, which looked at prescribing data in Scotland between 2016 and 2023. What it shows is that there was a small but steady increase in the progesterone-only pill prescriptions, which is that dotted line that kind of goes up, but with a marked decrease in the combined oral contraceptive pill over the same time period. And if you add these two lines together, then the overall trend is downwards. And this was also seen in the BPAS survey that I mentioned earlier, which reported that 44% of women had previously used a contraceptive pill as their main method of contraception, but now only 21% are reporting that. That same survey also asked about fertility awareness-based methods, which is an umbrella term that is actually increasingly representing femtech and technologies. The BPAS survey showed that around 1 in 20 were using fertility awareness-based methods as their main method of contraception. Apps in general are used more widely for things like period tracking and monitoring fertility in general, not as a contraception, with different apps validated for different purposes. There are actually very few apps that are validated as contraception. Young people, however, are increasingly turning to them as they're easily accessible, they offer knowledge and education, and also they've got autonomy of use over them. They're outside of the hands of healthcare providers. However, because they're outside of the hands of healthcare providers, they lack governance and accountability. There is huge variability in efficacy of these tools, and often the efficacy of them is not widely known or understood by the users. There's a lack of transparency about the commercial interests, and that there has been reports of data being sold to third parties, often without the consent or knowledge of the users. I think the take-home message from this is that they are a legitimate and useful tool, but only if the users are truly fully informed about all aspects of their use, which currently we've concerned that they're not. So looking at some of the outcomes, we can look at sexually transmitted infections. So in general, chlamydia has actually been decreasing over recent years, except in the cohort that we're talking about today. So in the under 25s, it still remains the most diagnoses within this group, and it has been increasing in this age group. Gonorrhea, which is what the graph demonstrates there, has been increasing, and you can see this peak in the under 20 age group, which is the kind of green line that you can see, with the greatest increase in the female under 20 age group, where it's increased by 300% over the last 10 years. And this may represent increased testing and reduced stigma around testing, but it's also hugely linked to a reduction in barrier methods of contraception. Another outcome measure we can look at is abortion, which has increased by 50% over the last 9 years. Between 2021 and 2023, we actually saw nearly a 30% increase in just 2 years. The increase has been seen across all age groups from 16 to 39, with the greatest rate in the 20 to 24 age group. There is also a social gradient where those living in the most deprived areas have got twice the rate of that of those living in the least deprived areas, with a rate of 25.4 in the most deprived and 12.2 in the least deprived. Finally, turning to teenage pregnancy, there was a concerted effort by the UK government to reduce teenage pregnancy up to 2010, where it fell year on year since then. Apart from the last publication of data where we saw an increase in teenage pregnancy for the first time in over a decade, the increase was seen majoritively in the under 20 and the under 18 age group, where the under 16s remained pretty static. So the take-home messages for this is that young people are engaging less with contraception. They are experiencing more STIs and more conceptions than ever before. However, they really do want reliable information, but from a variety of different sources in order for them to make truly informed choices. I'm going to hand over to Nikki now.
Oops, okay, thank you very much. I'm just going to very quickly talk through some of the cultural context. So in light of this wealth of insight that we've had, both from our engagement with young people and from all the evidence that we've just heard, it's worth reminding ourselves that they're living in a cultural context, and we need to explore some of the strengths and challenges that that cultural context offers. And we've already heard mention of the COVID pandemic, so it's worth bearing in mind that there is still a significant group of older children and young people that experienced the pandemic in ways that disrupted their sexual well-being. So in addition to the periods of time that schools were closed and there was no delivery of RSHP, we also know that delivery of recovery of RSHP education was slower than in other parts of the curriculum. So this means that many children and young people missed out on key learning over a period of several years, and they will have significant knowledge gaps. So what's the role of the kind of protective factors that we have available in Scotland? I think we should start with parents and carers. The role of parents is crucial because parents are children and young people's primary educators. And as such, it's really important that parents feel equipped with knowledge and confidence to have good, age-appropriate conversations about relationships and sexual well-being. Last year in Scotland, there was a national engagement exercise with parents and carers conducted through focus groups and an online survey to find out what parents' experiences of this are and what support they feel they need to have good conversations with young people. And these are the main issues that came from that. I'm not going to cover them all, but there is a few key things I'd like to pull out here. So one is that most parents, in terms of most of the themes of sexual health and well-being, do have conversations and fulfill that role of talking to their child with confidence. But one of the areas where they really don't have the same level of confidence is in relation to keeping children safe online. Parents have also asked for support, which includes information on what is age-appropriate learning and how to respond to questions that children have. And they've told us that they would welcome online resources to explore this with their children. And I'm very pleased to say that in a couple of weeks' time, nationally, we will launch a resource that does just that. So we'll circulate information about that. I think one thing that's very positive is that parents have told us that they are actually very content with what schools deliver in terms of RSHP. But if there's one area for improvement, it's on communication between particularly secondary schools and parents. Parents would like to know exactly what schools are covering in the RSHP content so that they can replicate those messages at home. Overall, parents show high levels of trust for the NHS and high levels of trust for children's schools as good sources of information. So we have plenty in Scotland to build on from that. RSHP in schools is also another really kind of positive role that we have that we can build on for young people's sexual well-being. Before I get into this, I kind of want to say a couple of things to keep in perspective that RSHP is not a magic bullet and it can't be the sole driver of positive change that we need to see for young people, nor is it solely the responsibility of schools to provide education and information to young people. But what we do know is that from now decades of international research that provision of RSHP is positively associated with better sexual health outcomes and prevention of harmful experiences. It's therefore a really important part of us getting it right for young people. So as I've mentioned, parents support the delivery of RSHP. Young people are consistently telling us that they want more of it and they want it more covering the issues that are important to them. And teachers are also recognising the importance of it as well. But what they're telling us is about challenges for delivery, both in terms of creating time for it in a packed kind of curriculum across the school, and also that teacher confidence is an issue. And unfortunately, we know also that RSHP has become a focus for anti-rights-based movements globally. And I guess the local evidence that we've seen for that in Scotland has been the volume and polarisation of consultation responses to the Scottish Government's draft guidance for the delivery of RSHP. And just on those kind of like global based movements, it's important, I think, that we pay attention to this growing coordinated movement of political far right ultra-conservative and religious interests, which are seeking to disrupt societal progress and roll back on rights-based approaches to sexual well-being. Globally, this is a movement beginning to make considerable gains, and we've seen across Europe and beyond countries change their legislation and policy as a result of these movements. And these movements gain traction partially through skillful use of online disinformation and by fostering links with some of the populist online movements, including the manosphere that Niamh was discussing earlier, or through online activists seeking to generate clickbait. And locally, we've started to see in Scotland some signs of this, some early signs. Until recently, we were seeing anti-abortion campaigning outside clinics until the buffer zone legislation took effect. But we've also seen coordinated and funded efforts to oppose RSHP in schools and to misrepresent interventions like the health and wellbeing census that the Scottish Government ran. So while in Scotland it's positive that we have a government and a parliament that's supportive of sexual wellbeing rights, we also know that the more misinformation spreads online, the more it can affect confidence. And to give you an example of this, in recent years, we are seeing more and more school teachers who deliver RSHP having to invest more time in reassuring parents about the real content of lesson plans in light of some of that online misinformation and disinformation. And so this requires us to be vigilant on behalf of young people to make sure their rights to good sexual well-being are protected both now and in the future, because the changes that we've just been listening to for the last hour about the profile of young people's sexual well-being are concerning. They are really concerning. And it's important that we address them assertively and don't inadvertently go backwards even further through inaction or a lack of vigilance of these factors that impact on young people's sexual well-being. And so just to summarise everything we've heard, I know we're running short on time, but just to summarise, I think where we are is that there is a growing gap between what young people, what adults and other key stakeholders recognise as being needed to support sexual well-being and what we have in place. And our overall question is, how can we change this to benefit current and future generations of young people? Joanne mentioned the summit that's taking place next month. So that's going to be a very positive first step. Logistics for that require this to be a relatively small event, so it is an invite-only event. However, if you've not been invited to attend, we would still welcome your views on what you think the most important issues that you've heard about today that should be taken forward for discussion there and for the shaping of subsequent actionable solutions. Joanne's going to shortly take us through the process to involve you in doing this, but just to finish, after the summit, we'll share a full report covering the process and the outputs, and we'll share that with everyone who's joined today on the call and with everyone who contributed to the focus groups in terms of the young people. So I'll hand back to Joanne for the final part. Thank you.
Perfect. I realise we are at the end of the session. I see many people heading off to the next meeting, but just a very final thought. We're going back to another Menti, so you know the sort of process. It's a different one now. We've made it so you can fill it in your own time. We would love to hear your insights. We've heard a lot of really interesting, thought-provoking things today, if not difficult to hear on some of the subjects, but we'd love to hear what you're seeing. So if you follow the Menti, so again, either menti.com, and the code this time is 62205044, or our QR code. We'll send it out to those who have had to leave or are just leaving just now, but we'd love to hear your thoughts, your insights. I can see some hands have gone up in the background, and I appreciate in this format we've not been able to have wider discussion. If you've got more to add that won't fit into the Menti, please do contact the email that organised the meeting today, so our colleague Kathy, if you want to send notes or anything that won't fit in the Mentimeter. But we would really value this. We're going to use this, take it forward in the summit, as Nikki said, and we'll report back to you on it it. So that brings us to the end. We will let you access and fill that in your own time. But just a huge thank you for your attendance and for your participation. We look forward to hearing your thoughts and your insights and taking this conversation forward. So thank you very much, and thank you to our speakers as well today.
Thank you very much, everybody.